Hello everybody, my name is Omar Melhem. I'm an assistant professor in Fatima College of Health Science in United Arab Emirates, Department of Nursing. Thank you very much for giving me the opportunity to present one of my research in this conference. We've been done a study about symptom burden in patients with a chronic obstructive pulmonary disease. The reason why I did this study because I'm interested in studying symptom management in patients with chronic illnesses, and COPD is one of these chronic illnesses I'm interested in. So I decided to study a new concept called symptom burden in those patients. So an overview about this presentation today. So I will talk about some background about COPD, some literature review about the study. I will talk about, in a brief, about the methods, and then I'll start talking about the result, and then we'll do some discussion and conclusion and some implications for nursing practices and research. As a background, for those who really maybe have an idea about the COPD, that the burden of this condition is growing worldwide, and it's a leading disease burden, and it's expected by 2025 this maybe condition will become the leading cause of death worldwide. And one of the things that if you look at from symptom management point of view, if we look at the gold guideline or any COPD guidelines, the symptom maybe management depends or rely on the lung function measurement, like spirometry. So we believe that reliance on lung function only is not a good indicator for symptom burden. So you have to measure and assess the symptom burden of those patients in different way. This is why we decided to conduct this research and talk about the symptom burden among those patients, not only using the lung function measurement or tests. Before I start talking about this concept, symptom burden, let me tell you this is a new concept, and as a definition for it, what's the meaning of symptom burden? Symptom burden is an individual experience that incorporates physical and psychological symptoms of a condition with the reference to severity, frequency, and distress. So if you see here that symptom burden is all about, as I said, psychological symptoms and physical symptoms. So both of these symptoms will make multiple symptoms, and then in our study we will talk about those type of symptoms with reference to 3 dimensions. Dimensions are the severity of the symptoms, the frequency of these symptoms, and the distress of these symptoms. And hopefully later on I will maybe try to make a definition what's the meaning by severity, what's the meaning about frequency, and the meaning about distress. So this is the concept of symptom burden. Okay, when we look at the literature, what has been done about symptom burden in patients with COPD, we found that most of the studies have focused on the prevalence and the number of symptoms experienced. So there's many maybe studies that talk about the number of symptoms, like, okay, we have a sample, and this sample maybe 300, 400, and experience maybe 2 or 3 symptoms, okay? They have shortness of breath, they have a cough, okay? The most prevalent symptoms. Other thing, when we look at some studies focus on just one dimension, and mostly it's the severity of symptoms. If you remember, we said symptom burden is not only severity. We have 3 dimensions. We have severity, frequency, and distress. So most of these studies only focus on one dimension. Again, in our study, symptom burden, we're going to look at the not only physical symptoms. We are looking at both physical and psychological symptoms. And this is one of the gaps in the research, that some studies focused on only physical symptoms, and they omitted the psychological symptoms. So after that, we found out and we concluded that there's a piecemeal picture of knowledge about symptom burden in patients with COPD is apparent, and then we decided, no, we're going to do and investigate the symptom burden for those type of patients. As I said, the aim of this research is to assess symptom burden in patients with COPD. We used a descriptive cross-sectional survey design, and to assess the symptom burden, we use a scale called MSAS. It's a Memorial Symptom Assessment Scale, and we have a sample of 214 patients with COPD, and those patients are recruited from one of the teaching hospitals in Ireland. And one of the things as well that we did not, we included all patients with COPD, which means all stages. We, in COPD, we have stage 1, 2, 3, 4. You have mild, moderate, severe, and very severe COPD. So we included all those patients. So we got an ethical approval for that, for this study, and then we started the data collection and data analysis. Data collection was conducted in the respiratory outpatient clinic for those patients. So let me just explain this instrument, because it's very important to understand this scale, to understand the meaning of symptom burden. So the MSAS, this scale is a patient-rated multidimensional instrument. So you ask the patient about the symptom, multidimensional instrument, which means you have one more dimensions, and the dimension, if you remember, we said we are talking about the severity, frequency, and distress. As well, this instrument evaluates the prevalence as well, but prevalence is not the dimension. Okay, so it was the severity, frequency, and this is the symptoms, and they asked the patient about if they experience symptoms in the last week. Okay, for the number of symptoms, this scale includes 32 physical and psychological symptoms. So 32 symptoms, 26 physical symptoms, and 6 psychological symptoms. And then when it comes to the dimension, the scoring of the Likert scale for each of the dimension range from 0 to 4. Example, like if a patient is not experienced, maybe if you ask about, like example, short of breath, we will ask the patient if he experienced short of breath in the last week. If he say no, the rating will be 0. But if he said like it's mild, like example for severity, if it's mild, we'll say okay, it's 1. Moderate, okay, it's 2. Severe, okay, it's 3. If it's very severe, it's 4. Okay, example, and for like same as frequency and same as distress. So again, if a score of 0 is given to a symptom of it's not experienced in the last week, but if the patient experiences symptoms, this will be rated from 1 to 4. So after that, so we started data collection. This survey was given to a patient, and by the way, for data collection, when I met the patient in the outpatient clinic, and I spent maybe 3 months collecting these data. For those patients, I usually maybe interview them, okay, and they will do the questioning the same day. But that time, when I thought that this patient is in hurry, he's not able to maybe complete the questionnaire, I gave it to him with an envelope, stamp envelope, and then I said to the patient, come on, complete your question at home, and then you can post it to me, to my house address. And that's what happened. So I got 214 patients, and those patients, as I said, they were patients with mild, moderate, severe, very severe COPD, 20.1%, about 43 patients mild COPD, 56 patients moderate COPD, 71 severe, and 44 patients with very severe COPD. So So when I assess the symptoms, when it comes to prevalent, we found out of the 32 symptom assessed, patients report a median number of 13 symptoms. So out of the 32, they reported a median 13 symptoms. And if you remember, we said we had 26 physical and 6 psychological. Of the physical symptoms, they reported a median number of 9 symptoms. And regardless the stage of COPD, those patients, they have shortness of breath was the most prevalent physical symptoms, reported by 93%. Lack of energy, 90%. They reported lack of energy. Cough, 83%, and dry mouth, 83%. And those are the 4 most prevalent physical symptoms. When it comes to psychological symptoms, patients report a median number of 4 symptoms. So out of 6, a median of 4 symptoms. Okay, and 80% reported difficulty sleeping is the most prevalent psychological symptom. Worrying, 71%. Feeling nervous, 62%, and feeling irritable, 62%. They reported they have these symptoms. If you see the table here, this is the maybe prevalence of symptoms. If you see here in the left, on the right-hand side, we have the symptoms here, the 32 symptoms, and we have here the overall symptoms, and then we have mild, moderate, severe, and very severe COPD. If you remember, we said like shortness of breath was the most prevalent symptom among all of them, regarding stage 93%. Like for mild patients with COPD, number 43, they all experience shortness of breath. The same as severe and very severe. They all reported that they have shortness of breath. Moderate COPD is 71% only. Lack of energy, if you see, 90% is the average for all patients, but the highest for 100% for very severe COPD, 97% for severe COPD, 75% for moderate, and 86%. Like if we come to psychological symptoms, example like difficulty sleeping. If you see here, difficulty sleeping, overall there was 80%, but the most prevalent was among patients with very severe. 95% reported are not able to sleep or have difficulty sleeping. And then severe COPD, 92%, 59% for moderate, and 71% for mild. If we take another symptom, example like feeling sad. If you see here, patients with COPD report 53% report that they are feeling sad. The most prevalent was among patients with very severe COPD, 68%, and then you have mild COPD, 56%, and then severe and moderate, 47% and 46%. They just reported that they have feeling sad. So these are a summary of all the symptom experience. Let us now talk about the result in relation to dimension of symptoms, related to about these symptoms, about the severity, the frequency, and the distress of these symptoms. We found that high frequency symptoms were reported by at least 50% of patients for 8 symptoms. So 50%, more than 50% of those patients reported that they have 6 physical and 2 psychological symptom experience with the high frequency. They are most frequent. High severity were reported by maybe at least 50% of patients for all symptom experience, except two conditions, 48% for skin condition and hair loss. The rest of patients, I'm talking about, they reported 30 symptoms are high severe. And for high distress symptoms, they reported for 7 symptoms, 5 physical and 2 psychological symptoms. When it comes to the symptoms, so we took an average for those dimensions, for the severity, for the frequency, and the distress, and we looked at what are the most maybe individual symptoms that patient have symptom burden on. So for each symptom, that average was taken and score was calculated, okay, and for each one, and then we found out that shortness of breath, the first one here, was the highest symptom burden, which means shortness of breath score the highest frequency, distress, and severity, and this will make symptom burden. Second symptom was lack of energy, 2.4, the mean. It's out of 4. Cough was 2.3. Difficulty sleeping, 2.2. Dry mouth, worrying, feeling nervous, feeling irritable, feeling sad, all came and maybe the first or the highest 10 most individual symptom burden experience. If you see here that the first 3 symptoms are physical symptoms, and then you have a psychological symptom here, difficulty sleeping, you have dry mouth, and then you have worrying, feeling nervous, feeling irritable, feeling sad. So if you see even half, if you remember, we only measure 6 psychological symptoms, but out of those 6, there's 1, 2, 3, 4, 5 of them. 5 of these symptoms are one of the highest symptom burden, and the rest are physical symptoms. In relation to total symptom burden score, for those patients, they were maybe have, when comparing the psychological symptom to a physical symptoms, no, those patients, they have higher psychological symptom burden than physical symptom burden. And for overall symptom burden, the highest symptom was among patients with very severe COPD, then followed by severe COPD, then moderate and mild. And when it comes to, and this is for overall, this is for physical symptoms, but when it comes to psychological symptoms, the patient with high severe COPD score first, and then patient with mild COPD, and then more severe and moderate. So patient with mild COPD, even they reported higher psychological symptoms than patient with severe or very severe COPD. For discussions, so after that, we think that this study revealed that patients with COPD experience a wide range of symptoms with a median of 13 symptoms reported over a 1-week time period. Of these symptoms, we have 9 were physical symptoms and 4 were psychological symptoms. Because those patients, the psychological symptoms maybe or psychological symptom burden was higher than physical symptoms, we think that the emotional burden of COPD was perceived to be more severe than the physical or physiologic burden. The majority of participants rated symptom as highly severe compared to highly frequent or distressing. Why is that? Because we think that patients with COPD acquire over time a level of adaptation to some of their symptoms, such as pain, sweating, and dry mouth. And one of the maybe interesting finding that the most problematic symptoms or the most maybe high prevalent and high symptom burden identified were not only the cardinal symptoms COPD. When we speak about cardinal symptoms, we're talking about the shortness of breath or cough, but no, patients, they have other symptoms. If you remember, we said they have lack of energy, they have a dry mouth, physical symptoms, they have many psychological symptoms. Unfortunately, the cardinal symptoms such as this dyspnea, shortness of breath, and cough, they are the focus of all international COPD standard and guideline. And these guidelines, they only maybe focus on the prevalence of disease-specific symptoms, as we said, shortness of breath and cough. They don't look at the subjective symptom experience such as the symptom burden. Example, I included an example like dry mouth. we said dry mouth was ranked the 5th most burdensome symptom, which means dry mouth is a symptom that rotates burden patients for COPD. Maybe this is because they have nebulizers, we have inhalers, they take anticholinergic drugs, so all this can maybe cause dry mouth. But this symptoms is not maybe managed, and it's not a symptom to talk to between maybe physicians or maybe the COPD specialists or maybe hospital nurse specialists or nurses and patients. But still, this symptom is a symptom that irritate those patients or maybe make their life difficult. So after that, we concluded that to improve symptom management, healthcare professionals should not only assess symptoms associated with COPD, they should take a general symptom into consideration and prioritize them in future care pathway. They should have a multidimensional symptom assessment and indicate that multiple symptoms that might burden those patients, not only focus on the cardinal symptom, not only should breath and cough, and it's very important. And they should do this multiple symptom assessment not only for maybe severe or very severe stage of COPD, they should do it for all stages, from mild until this very severe stage. An interesting thing that if you read maybe many researches about patients with COPD and cancer, studies say that they have a similar prevalence of symptoms. But those patients with COPD, they're found to live longer. So they experience these symptoms for more extended period of time. And even in cancer research, it's evident that patients with cancer, they benefit from palliative care, and this will improve their quality of life. So we concluded that because patients with COPD, they have a high symptom burden, that those patients would benefit from a palliative care approach. For implication for nursing practices, particular attention is required by healthcare professionals to assess and manage both physical and psychological symptoms, not only physical symptoms. Nurses, in conjunction with the multidisciplinary team, are instrumental in helping patients achieve acceptable level of symptom relief. Therefore, they should be educated about the occurrence of symptoms in terms of frequency, severity, and distress, and the overall symptom burden experience. And this is important in sensitizing the healthcare professional to the extent of the burden, and then which in turn will assist in operationalizing of an effective and nuanced care plan for relief of symptom burden for those patients. For our research, we did this research using cross-sectional approach, and we examined the symptom burden in COPD, and this design did not facilitate an exploration of symptom burden changes over time, especially that COPD progresses. So in the future, we are hoping to do another research, but we'll do longitudinal studies to understand the patterns of symptom changes over time. And this will provide a further insight into the symptom burden experienced by those type of patients. Thank you very much. And again, I'm really happy to present this paper. And thank you for your attendance. And you are more than welcome to ask any question related to this research. Thank you very much.